Staying healthy and getting exercise is important, but across the country, good health is more difficult for certain populations to reach. Here's why.
I know what it's like to have to struggle to feed your children and make good health food choices.
Andrea is a mother of 6. She wants to feed her family healthy foods, but finds that
stores in our neighborhood don't have good food selections and the prices are extremely high.
What kind of foods they have there versus a bigger grocery store.
Staff members at the Center for Health Equity are talking with people like Andrea to find out exactly what's needed to help people make healthier food choices.
Residents are really surrounded by fast food restaurants and corner stores and don't have access to supermarkets that adequately serve the kind of foods that we need to sustain a healthy life.
It's starting to become unhealthy for us.
This food security, having access to good quality, healthy foods, is an issue that's important to people's health.
We don't know for sure if people are going to eat healthier by just popping a nice grocery store or farmer's market in their community, but at least they have the access to it.
It's just one of the ways the Center for Health Equity is trying to address what are known as health disparities. These disparities are the differences in quality of health between certain ethnicities, races, and lower socioeconomic groups. For example, Hispanic and African American groups have higher rates of
diabetes, hypertension, cancer, cardiovascular disease, stroke, HIV, you name it. In the African American community, there are more than 83,000 excess deaths every year based upon these factors.
The goal of the one-year-old center is to get at the root causes of these disparities and then start making changes.
Since we've asked the questions, we now have an obligation to do something about it.
Recently, Louisville's Department of Public Health and Wellness funded a study to find out exactly what Louisville residents think about this issue.
The underlying beliefs that most people have about health make it difficult for the Center for Health Equity to get a message across.
Do you know what health equity is?
Health equity? No, I don't.
I hear of it vaguely.
It's so much easier and more convenient to eat unhealthy than it is to eat healthy. And actually, it's sad to say, but it's cheaper to eat unhealthy than it is to eat healthy, too.
People do have the choice as an individual in terms of their eating habits and that sort of thing. But again, you're only as informed as what you know.
The majority community may be completely unaware of the existence of these differences in health status and health outcome and life expectancy. In order for us to hopefully change this, everyone has to be involved. It has to be seen as a community-wide issue, not a us versus them.
But the process to address these disparities is just beginning.
Everything from the kind of job you have, your status at work, the kind of housing you live in, the kind of transportation that's available to you, all of that can have effects on health.
In addition to the study and planned marketing campaign, the Center for Health Equity is getting involved in a variety of other efforts, like the West End Vision Project. Members of this group discuss long-term solutions to the West End's challenges based on residents' relationships with business leaders, public officials, and community leaders.
We're retraining our public health workforce around the principles of equity and social justice and what this means as a public health entity. So they're learning how to do community organizing, they're learning how to do focus group work, they're learning how to do community capacity building and community empowerment strategies.
Where we are now is that we've got a pretty clear and vivid sense of what the obstacles are and some sense about what the promising directions are going to be to try to create that new lens.
People around the nation are looking to Louisville's Center for Health Equity as a role model for dealing with these health disparities.
This Department of Health has been really revolutionary in taking on this issue and having this kind of a center in the public health department. So I think it could be a real role model for public health departments across the country.
With its involvement, the center is starting to bring members of the community together to make a difference.
This is not something that can't be fixed. Systems, attitudes, resource allocation or lack thereof. Consequently, it means it can be changed.
I would like to do something about this and see what effect that I could have on it.
And helping people like Andrea feel empowered and connected with her community is an important step in the right direction.
While you address the policy issues around the built community, the built environment, civic capacity, getting people more involved in their government and their decisions, empowering communities to feel good and confident in who they are so they do the things that need to be done to change policy, to change governmental structure sometimes, to change economic development issues so that the community becomes strong and self-sufficient in all ways.
If you would like to learn more or get involved with the Louisville Metro Public Health and Wellness Department's Center for Health Equity, call 574-6616 or go online to louisvilleky.gov.
Metro TV, a public service of Louisville Metro government.